Welcome to the Diabetes Radar demonstration video. The Diabetes Radar can be accessed on the WSIC landing page by clicking on the long-term condition management product and then the Diabetes Radar icon here. There are a number of scenarios where we envisage that the Diabetes Radar may be of use. For example, the radar will allow clinicians to visualize clinical metrics and values, complications and comorbidities of individuals in order to identify cohorts of patients that may require additional support. The radar could also help to facilitate MDT discussions, allowing rapid identification of patient cohorts with the use of predefined searches of high-risk individuals for discussion or enhanced care. Data sources within the radar include GP data and acute data. By referring to the purple banner at the top right, you will be able to identify the latest data available within the radar and the latest refresh date. As the radar is interactive, users can customize cohorts of patients within their interests by selecting different drop-down filters. The segment filters represents predefined categories of patients that segments the population into patients with similar needs to easily target those who may require additional support. Users can view segment definitions by hovering over the information icon. Should a user want to view newly diagnosed patients within the last 2 years with the latest HbA1c of over 53 or more than 5 results above target, they can simply select the Yes option within the newly diagnosed segment filter. And the dashboard will update to reflect the user's filter selection. The filter by and in the order filter forms a 2-step process for creating your chosen view. In this step, a user chooses a metric of their choice that will be used to sort the entire list of patients by any one of the options they select within this filter. A user will then select the sort order, for example descending. The results of the 2 filter selections will show all patients where patients with the highest HbA1c are listed first. The Health Borough, PCN and Practice filters will either be already selected depending on your access, or you will have the option to select which Health Borough, PCN or Practice you are most interested in. The Provider filter reflects a patient's main acute provider, and this is based on acute activity over the last 2 years of SUS data. The Age Band filter allows you to segment the diabetes population into smaller age ranges. The Ethnicity filter allows a user to filter patients based on their ethnic category. This is based on coded data within primary care. The Deprivation filter enables the user to select the deprivation scale they are most interested in, 1 being the most deprived and 10 being the least deprived. The Diabetes Type filter allows the user to select the patient's diabetes type. Options include Type 1, Type 2 and Other. Other relates to other types of diabetes such as AS, LADA, NOS and remission. The Foot Risk filter indicates a patient's individual current risk status. The letter on the left corresponds to the left foot and the letter on the right corresponds to the right foot. Possible values include L for low, M for moderate, H for high, U for ulcerated and A for amputated. Missing or blank options signify there is no foot risk status recorded. Frailty or EFI is based on an individual's frailty score coded within primary care. It ranges from fit, mild, moderate and severe. A patient's EFI score is based on a total number of individual deficits and 8 different categories. A more detailed breakdown of all 8 categories and deficits can be found within the user guide. Users are able to reset any previous filter selections by selecting View Original and Original Default. Within the first few columns of the radar itself, you are presented with patient details followed by their diabetes type and diabetes duration in years. If there is no diabetes date on record within the GP system, this cell will appear blank. Within the next few columns where values are present, we can see the UK PDS column, which is an algorithm based on the risk of developing heart-related complications based on blood results and a patient's duration of diabetes diagnosis, followed by individuals' latest key care process results, FIB4 fatty liver calculation, PHQ4 and DDS2 results, which are all coded within primary care. SNOMED codes for each of these indicators can be found within the calculated definition section of the user guide. Users can click and hover over a specific cell from columns HbA1c to urine ACR to see the last 10 scores, if performed in the last 10 years, for the selected patient and the selected metric. Here I have selected HbA1c for a patient. The tooltip will show the patient's name, date of birth and NHS number, as well as the patient's last 10 HbA1c scores. If a user wants to view another key care process visualization, make sure to first close the current tooltip by clicking on it again, and this will clear your selection. A user can click and hover over a specific cell within the tooltip Click Here for Detail column to see detailed information relating to a patient. The tooltip will show a patient's name, date of birth and NHS number. The tooltip will also show a patient's diabetes type and when they were diagnosed. The complications that the patient has will also be listed alongside when these were identified or diagnosed. Serious mental illness diagnosis date will also be shown if present. Finally, the patient's start date on educational and support programs will also be present. A user can navigate to the temporal view dashboard from this tooltip by clicking on the hyperlink at the bottom of the tooltip, which we will navigate to a little later on within this demonstration video. On the right hand side of the radar we can see foot risk status, smoking status and renal screening results. Foot risk. As discussed earlier, the left letter corresponds to the left foot and the right letter corresponds to the right foot. Possible values include low, moderate, high, ulcerated and amputated. The next column pertains to the smoking status. Possible values include blank for no status recorded, N for non-smoker, X for ex-smoker, Y for smoker. The next column pertains to the renal screening. The left letter corresponds to the left eye and the right letter corresponds to the right eye. More information about this indicator can be found within the user guide. Complications. A flag will be present within the complication column if an individual has been diagnosed with a problem or a complication coded within their patient records. A full description of included complications and associated SNOMED codes can be found in the user guide. An SMI flag will be present if a patient has been diagnosed with a serious mental illness. Frailty, or EFI, is based on a frailty score coded within primary care. It ranges from fit, mild, moderate and severe. A flag will be present within the next 3 columns if a patient has attended education and support programs. A flag here will be present if a patient has had any one of these diabetic medications within the last 6 months and it has been placed on repeat. A flag will be present for the remaining lipids and hypertensive medications if these have been prescribed within the last 6 months. There are 3 ways a user can navigate to the temporal view: by selecting a cell within the key care process columns, or selecting a cell within the tooltip Click Here for More Details, or by hovering over most of the cells on the left hand side of the dashboard. All 3 methods will display a different tooltip where a user can select Click Here to view timeline to navigate to the temporal view. The visuals will show the evolution of a patient's test scores depending on which button at the top is selected. The graph will show the last 10 years of data and updates within the rolling window. The colour legend in the top right will help identify which line corresponds to which measurement. This will automatically update depending on which button at the top is selected within the View Selector panel. A tooltip is also shown by hovering over a particular line. It will display a patient's results or scores and the date recorded. Where there has been a target set for a patient, this target will be represented on the visuals. For example, here a BP systolic target of 140 is shown, and a BP diastolic target of 80 is shown. The medication time series visual will show the evolution of a patient's medical history with each button selection. This will show the last 10 years of data. The medication that will show under each view selected button will differ. The start of the bar represents the prescription start date. The length of the bar represents an estimation of how long the patient will take to finish the medication. Hovering over the bar will display a tooltip which will show which group each medication belongs to, the exact medication name, when it was last prescribed, and how long in days the patient is expected to take the medication for. The temporal view will allow users to monitor trends over time for specific indicators in order to make informed clinical decisions. Again, selecting another button will display another prescribed medication and its medication group. A user is able to focus on the visuals of the dashboard to a specific time period by using the date slider. The date slider will filter both the graph test time series and the medication time series visuals. A user can either drag the handles to change the date or click on the start and end date and use the calendar widget to select a specific date of interest. Clicking on the Clear Filter button, which is visible in the top right hand corner when the slider filter has been applied, will reset the slider to the full time window. Clicking on the back arrow will take the user back to the diabetes radar view. If you feel this dashboard will be useful to identify patient cohorts for discussion, visualize key metrics, monitor trends over time, identify likely support needs, or support PCNs in understanding their local population health priorities and the benefits that are being delivered, please request access by contacting the WSIC team at nhsnwl.wisicsupport@nhs.net. Dummy data has been used throughout this demonstration video. Thank you for watching.